Hello, this is Dr. Gay from First Look MRI, and this is a 55-year-old woman who has really bad swelling in her medial ankle and foot. She says she's had flat foot deformity, and her podiatrist sent her in to look at the ankle here. And she said there's pain, but it's not a whole lot worse than before, just much more swelling lately. So on this view, we see we're high above the ankle joint. This is the tibia, this is the fibula. Here's the Achilles tendon back here. We see our 3 tendons along this side here. We have the flexor hallucis muscle and tendon, flexor digitorum, and over here we have the posterior tibial tendon. And the posterior tibial tendon is the thing that is abnormal. Lots of edema in the soft tissues around here. This is really big and puffy and swollen when I saw her clinically. And this whole tendon is just huge. And if we follow this above, this is pretty high above the ankle. You see it's in the supramalleolar portion. And down at the level of the ankle joint, it's still there. And then the inframalleolar portion is even larger. And it goes all the way down to the navicular attachment. So the question is this a hypertrophic tear or hypertrophic tendinopathy? And if we put up the T2 weighted images, we're going to look at this attachment. Here's the navicular bone. We can see continuity here is coming off, going up, up. Things usually look a lot better on the T2 weighted images than T1 weighted images. And we can see this nice dark band, so it's not ruptured, it's just enlarged and has lots of increased signal within it. So this is what we call severe hypertrophic tendinopathy. And also there's fluid in the tendon sheath, so tenosynovitis. So it looks like she's probably had a chronic hypertrophic tendinopathy, and lately she's developed this tenosynovitis and this prominent fluid in the soft tissues, or edema rather, within the subcutaneous soft tissues. Shows up a little bit better in this T1 weighted sequence. So an example of hypertrophic tendinopathy without tendon rupture and tenosynovitis in this woman with a flat foot deformity. And that's it. Thank you very much.